Namaskar. In this session of Swayam Prabha, we are going to discuss customer needs and satisfaction. The objective of this session are we would learn about customer and their types, the Indian healthcare landscape. We'll try and define customer in healthcare systems, key customer needs, factors influencing satisfaction, and challenges in achieving high satisfaction, and also strategies for improvement. All of us have been customers almost on a day-to-day basis, but let's see how the managerial science looks at customers. Customers are people or businesses who are either currently purchasing or have purchased or may be interested in purchasing a product or a service from another individual or company. This definition comprehensively describes that people or entities or both can enter into a transaction of procuring a service or a product and thus become the customers. Now, customers may be first time buyers who are exploring products and or services, which are called new customers. Loyal customers are the ones who buy frequently but with a strong affinity for a particular brand. Then there are impulse customers, that is individuals who make unplanned purchases just at the spur of the moment based on what they desire at that point of time. There are discount customers or bargain hunters. They are motivated solely by the sales or promotions and looking for something which is available cheaper than what they had purchased earlier. Or if they believe that things are going to be available at a higher cost, then they would try and buy it today thinking that there is a discount. Then there are dissatisfied customers, those who have had a negative experience and might be returning a product or seeking a resolution. These dissatisfied customers are of great importance to businesses who take their feedback and accordingly modify their approach to marketing or improve their products or both. Our talk is going to be mainly on customers in the healthcare system, and so it is better we have just a broad look at the Indian healthcare landscape. It is one of the fastest growing sectors which is driven by increase in population, health awareness, demand for quality health care and increase in disposable income. In addition, India is fast becoming a hub for medical tourism and a specialized care at competitive cost. It is important to understand that in India, even though we may complain about the health system in many ways, but still the specialized care is available at a very reasonable cost when we compare the cost of healthcare in other countries. Indian market structure is a mix of public hospitals and private hospitals. Public hospitals are often either free or provide services at a very low cost, but then there are resource strained. There is a huge demand because a section of population living below poverty line or people who are not able to afford private health care are the ones who throng these public hospitals. Private or corporate hospitals, on the other hand, they focus on quality, technology and patient expectations. They are pro-profit organizations and they sell health services as a product or as a service. Then there are rising expectations. Customers are becoming health conscious, better informed through online reviews, social media, and there is a rising demand for good quality healthcare services. Quality and safety have become critical differentiators between a good quality or an acceptable quality of healthcare. Then there are accreditation institutions like National Accreditation Board for Hospitals, National Accreditation Board for Laboratories. These institutions have come up which basically examine and inspect the healthcare services and give them accreditation. Then Government of India initiatives like Ayushman Bharat Yojana launched by the Prime Minister Modi ji has led to high expectations because it is primarily financing poor people to an amount of rupees 5 lakhs per family per year for getting themselves treated. In healthcare system, the primary customer is the patient. He or she is the direct recipient of medical treatment and care. Their needs are paramount. Then there are secondary customers or stakeholders, which are attendants or family members. They are often the decision makers, financiers, and primary source of emotional support to their patients. Experience of the secondary customers like waiting room, communication, assistance or help, counseling, etc. are equally vital in Indian context. Then referral doctors, professionals who trust and recommend the hospital services. If a doctor practicing in the community or a local practitioner, if he or she has to refer a patient to a particular hospital, then this professional, this doctor has to have trust in the services of the hospital. Then insurance companies and government schemes are also major players because they become the financiers of the healthcare services provided by the hospitals. There are 5 core dimensions of service quality which are often called as ServQual model. The ServQual word originates from service quality. There are first dimension is tangibles. Things can be achieved, things which are physical in nature. For example, cleanliness, modern equipment, comfortable waiting areas, hygienic wards and toilets. Second is reliability, which is dependability and accuracy. Accurate diagnosis, error-free lab reports, correct administration of medication, consistent quality of care make a service reliable, and it is one of the important customer needs. Customer also want the hospital services to be responsive, prompt. Short waiting times in registration, medical consultations, getting the reports are important. Customers want quick response to calls and prompt attention whenever they land up in the emergencies. They also need assurance, which is trust and confidence, knowledgeable and courteous staff, doctors' competence, confidentiality of information, patient safety and security measures as a hospital policy. They assure the patients of good quality. Then empathy, a caring and individualized attention for patients. For this, the staff and doctors must be compassionate, respectful, active listeners, and they must address to pain, explain the procedures clearly so that the patients are not left confused. This is the graphical presentation of the ServQual model, in which the service quality is at the center and all the 5 parameters, that is tangibles, reliability, empathy, competence and responsibility, they are in the periphery, all feeding onto the service quality. How do we come to know what are the customer needs? We take direct feedback, that is by conducting surveys, interviews, focus group discussion, where we ask the customers directly about the challenges they faced in the hospital or whatever they learned from others, whatever was their experience with the hospital services and how it can be improved. Such feedbacks not only help the hospital to improve, but also build confidence in the customers that the hospital listens. We can have data analysis, that is, we can review the historical customer data, track the purchase pattern, analyze satisfaction data to identify recurring problems and opportunities. For this, it is important that the hospital has to first generate data. There should be a mechanism of compiling and collecting data within the hospital, then only you can analyze it. Social media research, one can use social media listening and keyword research to understand what customers are discussing online and what information are they searching for. One can also conduct a market research by studying one's competitors and to understand how they are meeting the customer needs. Then they can identify the gaps in their services and improve. Customer journey mapping is another example to map out the customer journey to understand their experience at different touch points and identify the pain points or areas for improvement. Let us discuss factors influencing satisfaction. Now, in this grid, we have identified 5 different categories and we have listed key satisfaction drivers and areas for improvement. For example, clinical care is one of the important factors that influences satisfaction because that is the primary need of the patient. And satisfaction drivers are doctor's approach, communication, explanation of the disease or the treatment, perceived quality of treatment and positive health outcomes, how empathetically he listens to the patient and what are the areas of improvement. If he is able to explain the side effects or post-treatment instructions in advance, involvement of the patient in shared decision making, it will be better. It will be an area for improvement. Then next category is administrative. We must have transparency of cost, especially in private sector. There should be upfront estimates and there should be ease of admission or discharge. Billing process should be efficient and grievance redressal should be quick, and there should be second category for factors influencing satisfaction is administrative. Transparency of cost is very important. The hospital should be able to give upfront estimates so that people are able to understand, ask questions and get prepared financially to meet the costs. Similarly, the ease of admission and discharge, efficient billing process and grievance redressal are other areas which may be key satisfaction drivers. Areas of improvement are reduced perceived cost, reduced cost of investigation, avoiding complex billing and efficient help desk. In case a patient or a relative has any question or any query, it must be addressed. Then interpersonal factors, the key satisfaction drivers are staff behavior, courtesy, respect, empathy and willingness of nurses to listen and to provide clear instructions. Areas of improvement are avoiding rude or short-tempered front office staff, which generally occurs when people are overworked or under pressure. Those issues must be addressed. There should be frequent changes and long duty hours should be avoided. Other areas of concern are people should not show lack of commitment or interest in patients' concerns. Then infrastructure, cleanliness, comfortable seating, clear signages, quiet and comfortable environment are good satisfaction drivers. Noise levels reduction can be an area of improvement. Many times patients are disturbed by beeping monitors, staff conversations, especially if they are loud, or noisy wheelchairs or stretchers. They should be managed properly. Then reduction of time, minimal waiting time for registration, consultation and reports is essential to improve satisfaction, and time spent in pharmacy, long wait for doctors for consultation, especially in OPD, is an area of improvement. Now, what are the challenges in achieving better satisfaction? There is a resource demand mismatch, especially in the public health sector because the patient volumes are high. This leads to overworked staff, longer waiting times and less personalized attention. And this is happening because still in India there is a large section of population which is not able to afford private health care. These people throng the public hospitals because they are free. So, we see a situation where a 100-bedded hospital is housing 120 patients at any given point of time. An OPD which is planned for 1000 people, there are 2000 people attending the OPDs. So, this resource demand mismatch can only be addressed by proper planning, decentralization of efforts, that is large hospitals must be linked to the smaller peripheral hospitals where people can get good quality care near their places of residence. Second is communication gap. Lack of transparent pricing and itemized billing is a common factor that leads to mistrust. Doctors are not able to spend enough time in explaining diagnosis or treatment, again because of either overwork or when they are tired or when they are working for very long hours. Situation can be addressed by adding more doctors, but again, in a country like India, there is a paucity of doctors, especially in rural areas. As a result, a large section of population has to move from the rural areas to urban areas just for treatment. This is a challenge for Government of India, and the Ayushman Bharat Yojana is an attempt to take care of this. Interpersonal issues, that is soft skills, the lack of them is often the cause for dissatisfaction. So, staff should be trained to be empathetic, in active listening and compassionate communication, and especially they should be able to manage their stress better. Infrastructure inadequacies like maintaining cleanliness, managing noise, ensuring comfortable patient amenities, they are the issues which need to be addressed and they remain a challenge. Then making a balance between high patient expectation with the realities of the Indian healthcare cost infrastructure is another challenge for the system. What should be the strategies for improvement or the actionable steps? Enhance the communication and empathy, that is mandatory staff training for all staff, clinical and non-clinical, on empathetic communication, de-escalation of conflict and active listening. Streamline the process and technology, go for digital solutions, implement online appointment bookings, implement digital health records and patient portals from where they can access the results of the investigation done on them. Reducing waiting time can be done through use of appropriate technology for queue management, and there should be clear explanation for delays, if any. In case a patient has to wait, there should be somebody who should be able to explain or reassure. Then streamline the processes and technology, customer friendly policies and customer relationship management. The hospital policy should support use of IT systems to personalize care, manage follow-ups and automate appointment reminders, etc. Focus on tangible and comfort. Implement noise reduction initiative is one example, silent zones, maintain equipment. Reducing noise in ICUs is a very important factor. Daily rigorous audits for cleanliness and hygiene. Ensure adequate comfort like seating, water, temperature control for attendants. Transparency of operations and patient safety are of utmost importance. Price estimates should be available beforehand whenever a patient is asked to make payment. Billing process should be simple. Discharge should be easy and fast. There should be SOPs for patient safety, adverse event reporting, hospital infection control and informed consent, etc. Counseling or help should be available for aggrieved customers. Digital and paper surveys, post-visit feedback is essential to gather real-time data on which hospital can improve its services proactively. A word about maintaining hygiene and grooming, which is dressing. It is important that the patients get a good impression of the hospital staff. So, wearing uniform is important. It helps in recognizing various kinds of professionals. Adherence to personal hygiene standards, appropriate dress code and regular hand washing are important. Along with the environmental cleaning, hygiene and grooming, it helps prevent infections besides maintaining a professional environment. For staff, this may include clean, tidy attire, short nails and avoiding strong perfumes. These are important. Just to conclude, patient satisfaction is the ultimate measure of service, quality and critical determinant of hospital success, reputation and loyalty. In the Indian context, satisfaction is highly dependable on doctors' competence, staff empathy and administrative efficiency and transparency. A holistic and patient-centric approach from the front office to the doctor's bedside is essential for sustained competitive advantage. The hospital policy and staff should be customer friendly and it should be visible amply. Thank you.